Good evening and welcome to Scotland at 7 on Tuesday the 31st of August. My name's Maggie Lennon and we'll start the programme with the up-to-date coronavirus statistics. As of 2 o'clock today, a total of 2,753,729 people in Scotland have been tested through the NHS Scotland labs and UK government regional testing centres since the start of the pandemic. Of these, 2,323,204 have been confirmed negative and 430,525 have tested positive. There are 6,026 new cases of COVID-19 confirmed by a test, although not everyone with the virus will display symptoms and not all those with symptoms will be tested. There are 7 new reported deaths of people who've tested positive. And the number of patients in Scotland who have died from complications caused by the infection now stands at 8,118. This number only includes those who have died having received a positive test for the virus in the previous 28 days. Of the people who have tested positive, 585 were in hospital last night, 54 of whom were in intensive care. As of 8 o'clock this morning, 4,106,408 people had received their first dose of the vaccination and 3,680,761 have received their second dose. The latest UK daily figures show 132,535 patients who tested positive for COVID-19 have sadly died from their illness, an increase of 50 since yesterday. This number refers to deaths in all settings, not just in hospitals. And the Office for National Statistics update reports that coronavirus infections have increased across England, Wales, Northern Ireland and Scotland in the latest week, ending the 20th of August. In England, the percentage of people testing positive increased for those in school year 12 to those aged 24 years, as well as those aged 50 to 69 years, while there was a decrease in positivity in those aged 2 years to school year 6 and those aged 25 to 34 years. In the week ending the 20th of August, the percentage of people testing positive increased in the South East and West Midlands. There were early signs of a levelling off in proportion of people testing positive for COVID in the North West, following an increase in recent weeks. There were also early signs of levelling off in Yorkshire and the Humber after a decrease in recent weeks. There were 652 deaths involving COVID-19 registered in the week ending 13th of August 2021, accounting for 5.5% of all deaths in the UK. This is an increase from 611 deaths in the week before. Deaths involving COVID-19 increased in all age groups over 45 years in England. And of deaths in England and Wales, where COVID-19 was the underlying cause, the most common pre-existing condition recorded on the death certificate was diabetes from April to June 2021. This was identified in almost a quarter of the COVID-19 deaths. I'm joined tonight to discuss the week's big stories by Richard Thomson MP for Gordon. Good evening, Richard. How are you?
Evening, Maggie. Doing very well, thanks. How are you?
Obviously, the figures for COVID are still a concern in Scotland, but the fact that things seem to be levelling off in England is perhaps a suggestion that we're going to be getting into a similar pattern, given that we were a bit later in opening up back to beyond level 2.
Yeah, I would certainly hope so. And let's be clear, it's very, very good news that is the case. There's an awful lot of people are moving back and forward between Scotland and England because of family commitments or work commitments. And so in England the trends there have generally been slightly ahead of where they are in Scotland. So I think the other encouraging thing is the vindication of the vaccination programme. We're seeing that although there have been some worrying increases, we haven't seen the same level of hospitalisations as we would have seen at earlier stages of the pandemic. So if things are flattening off in England, I would expect that Scotland wouldn't be too far behind that. And but again, the thing is vigilance.
Indeed. Well, MSPs returned from their holidays this week to the Scottish Parliament, and it returned with the vote to appoint the 2 new Scottish Green Party ministers, confirming Patrick Harvie and Lorna Slater in their new posts. The proceedings continued with a debate on the Scottish Government's first 100 days, in a motion which welcomed the delivery of 80 key actions that will have a positive impact on the people of Scotland by leading the COVID-19 recovery, supporting NHS and care services, tackling the climate crisis, backing economic recovery and creating jobs, supporting communities and helping children and families, and recognises these actions as the foundation of improved outcome for Scotland's people. The First Minister's statement on the programme for government has been rescheduled to next week and is expected to set out the plans for COVID-19 recovery programme and the shared policy programme agreed between the Scottish Government and the Scottish Green Party. I'm just wondering, Richard, were you at all surprised at how positive both the SNP members and the Green Party members accepted the new deal between the two parties?
No, I wasn't actually. I think that there's always been a fair bit of overlap in terms of outlook between the Greens and the SNP. I mean, there are partisans on both sides who would always point to the very considerable differences there are. But I think that over the piece there is viewed from a distance, there is quite an overlap, and there's never been that animus or enmity between the parties as there has been between other parties in the Scottish political firmament, shall we say. So I think the fact that there were obviously long, detailed, thoughtful discussions round about this, and a great deal of care had gone in. I think people were quite pleasantly surprised at what emerged on the other side of those discussions. And there's a set of policies there that might not be all that either party had necessarily would have hoped for out of any cooperation deal. But I think folk in both parties have been quite pleasantly surprised by what actually is in there, and I think it sets the Parliament up well to on a number of fronts. It should set the Parliament up well in terms of the delivery of that policy programme, which I think is ambitious but realistic. I think it will help the Scottish Government. I think that I used to lead a minority coalition on Aberdeenshire Council, so I know how much noise and bother there can be from day to day trying to get your business through. So the very fact that the government now has a majority should help to smooth the path of a lot of legislation. Doesn't mean the government can take its eye off the ball or ignore what the opposition says. Any wise government should always do that, but it should take some of the noise out, particularly around some of the unnecessary partisanship that we saw in the last Parliament, where opposition parties were trying to gang up to pick off individual ministers in votes of confidence, or to defeat them on particular bills and votes, often just for the sake of it. So it should take some of that noise out and allow ministers to raise their sights and concentrate on instead of the political survival and over certain issues to the end of the day, being able to take that longer view. The other thing I think it sets us up well for is independence. It will help to the vision of independence, I think, that needs to be refreshed from where we were in 2014. I think it will give that a refreshed outlook from government, and that sort of cooperation between the two major parties of independence, I think, is something that bodes well. Well, obviously there's a fair bit of work to be done, but with a COVID recovery plan coming out, with the two parties of independence represented in Holyrood sitting together in government now, I'm quite optimistic about the way forward on this.
And it should make passing of future budgets much easier as well, without the toing and froing, which has sometimes held up what actually Parliament's been able to do.
Yeah, that's absolutely right, Maggie. I mean, there's two things they say that you should never see being made, and that's laws and sausages. And I think to that you could probably add budget decisions sometimes as well. I've always been in awe of the way that Scottish Government ministers, whoever's been in charge of the process, has been able to set out the prospectus and then corral the votes together necessary to get that through. And of course, there's only been one occasion since the SNP took office in 2007 where they haven't been able to get through a budget at the first attempt. And I think everybody I think everybody quickly came to their senses when after that happened. So, yes, it takes up a lot of time. It can take up a lot of resource. You lose something in coherence. So, being able to get at the outset of what's still at the outset of a parliamentary term, being able to set out a coherent policy programme with agreement from a majority that that's what they want to do, and agreement on how they wish to do it, it should make the budgets a great deal smoother to get through.
Obviously, we won't know now till next week because the programme for government has been delayed for a week. We won't know exactly what bills are going to be presented. I mean, one of the areas where I can see the union between the two parties, or whatever we should call it, it's not a coalition, the agreement between the two parties might cause the SNP some problems on maybe their more centrist and right wing of the party, is the Gender Recognition Act, which clearly the Greens have been pushing very hard. And SNP effectively kicked that into the long grass. And it hasn't reappeared, but it's going to have to come back onto the statute book at some time. So do you think that might be an issue that stirs up some of the ill feeling that we saw in the party, earlier this year?
Well, I think there are clearly a number of people who have concerns around that, and some of whom have been exceptionally vocal. But, this has been part of the SNP's policy platform to reform the Recognition Act for a few elections now. And it was very plainly part of the deal that has been struck with the Greens, and it's now been endorsed by an overwhelming majority of the members who voted in that ballot. So I don't expect people who are unhappy about this to suddenly become more content with it. I think there is a work can be done to discuss what this actually means in practice, because certainly the further I've delved into it, I've found that there is perhaps less to much of what is proposed in terms of making it easier for people to get the legal recognitions inherent in that than perhaps we're invited to believe meets the eye. So it's certainly had an overwhelming endorsement from both parties' memberships, and I would expect that the way is clear now to move ahead on something that has, let's face it, been in the party's manifesto for the last few elections.
Well, it certainly has. And I think a lot of the noise is kind of noises off. It's no longer people who are actually in either the SNP or the Green Party, but no doubt it will be something that we'll cover in future programmes. A nationwide marketing campaign to raise public awareness of the signs of a drug overdose and the life-saving medication naloxone has been launched to mark International Overdose Awareness Day. The Scottish Government and the Scottish Drugs Forum have teamed up to help inform the public of the medication, which can reverse the effects of an opioid-related overdose. TV and radio adverts and billboards at transport hubs and shopping centres will encourage people to go to the Stop the Deaths website to learn how to identify when someone is experiencing an overdose and how to get a naloxone kit and be trained to use it. The campaign aims to inform the public how to respond to an overdose and provide an early intervention that could save a life, and is therefore a vital part of the national mission on the drugs death crisis. Police Scotland officers have played a key role in the front line in preventing deaths from drugs overdoses and have already administered naloxone nearly 40 times in the 4 months since they began a national pilot project. The naloxone test of change for the nasal spray, which was used as an emergency first aid response to suspected opioid or opiate-related drug overdoses, is the largest of its kind in UK policing and has attracted significant interest from forces both in the UK and around the world. Nearly 800 officers have now completed training to use the intranasal spray devices, with 81% volunteering to carry the kits during the trial period. To date, naloxone has been used at 18 incidents in Tayside Division, Dundee City Subdivision, 15 in the Greater Glasgow Division, Glasgow East Subdivision, 3 in Forth Valley Division, Falkirk, Grangemouth and Stirling areas, and once in Highlands and Islands Division in the Caithness Subdivision. Naloxone has now been used in all 4 testbed areas, and officers in local custody centres in these areas have also been trained in its use. Situations where officers have decided to administer naloxone have ranged from police attending concern for person calls, including attempted suicide, while people are in police custody, and during a siege situation when officers had to force entry to a property. In all incidents where someone has been given naloxone by a police officer, they have survived what may have been a life-threatening situation. This has to be a really positive development, doesn't it, Richard? And we know that the Scottish drug deaths are the highest per capita in the UK.
Yeah, absolutely. And I've watched this with interest, and it's very pleasing to see the successes that this trial has already had with, as you say, 800 officers carrying the naloxone around with them. And I think that the geographical spread that there's been in terms of the usage throughout the trial just goes to show the extent to which this is a problem that doesn't tag itself to any particular geography in Scotland. It is something which is common across all parts, or can be found in all parts of Scotland. And our drugs deaths, as we know, they're very, very high. I think particularly in those who are injecting opioids, there has always been the danger that they don't necessarily know what it is that they're injecting. That sounds daft, but what I mean by that is you don't necessarily know the potency of the drug that they're injecting, how it and what's gone into it. So the fact that there is always that danger of overdose has, I've got absolutely no doubt, contributed greatly to Scotland's drugs death total over the years. So having something like naloxone, which is there, which people know how to use, which can be made widely available, helps to solve part. We spoke last time I was on about how I felt there were many drugs problems in Scotland. This is one of the drugs problems that we have, but naloxone can go some way to helping to pull somebody back from that brink and neutralise the opiates and keep them alive and give other options for helping them come to terms with their situation. So I think it's tremendously good news to hear the successes that there's been, and I would like to see this rolled out as widely as possible, as quickly as possible, so that we can save as many people as possible.
Well, it's certainly been welcomed by, I think, pretty much everyone who's involved with people who are injecting, especially people who are injecting drugs. And I think the idea is that it's not just first responder services that will have this, that it's encouraging people who are friends and family of drug users. Perhaps a bit like it will become the point where that is something that's commonly found in workplaces, along with defibrillators, as just something that is there as a kind of just in case sort of thing.
Yeah, I was just about to give the example of defibrillators. Who would have thought, 20 years ago that would be a thing that we would be able to help people who are in cardiac arrest with, and to the impact that widespread installation of defibrillators has had has been phenomenal. So yeah, absolutely. I think in time this is a thing that we will, just like recognising, the symptoms of other medical conditions that are immediately life-threatening. I think that the more people who learn to spot the signs with which they may not be familiar in their daily lives, the more people can recognise the signs in others that somebody might be experiencing an overdose, and the more people who, having recognised that, know not only what to do, but also how to administer a cheap and readily available antidote, for want of a better description of Naxalone, I think the better. And you're absolutely right. I think this could become as common as it needs to be, and I would view it in the same way as you would view any other kind of life-saving equipment that we commonly see in the public space.
And that just keeps that message that it is actually a health issue, not an issue about crime. It's an issue about health, and obviously it hopefully will reduce death. It doesn't necessarily tackle the use of opiates within the community, but it is a good start and therefore welcome. A top UK climate expert has said he is pleased with the progress Scotland is making on tackling climate change. Lord Debon, chair of the Climate Change Committee and former UK Environment Secretary, told Holyrood's Net Zero Committee that Scotland's approach has allowed him to say to other parts of the United Kingdom, why don't they do it as well as the Scots? Scotland has passed world-leading climate change legislation as part of the aim to become a net zero country by 2045. something hailed by the UN as an inspiring example of the level of ambition we need globally. However, it's not been 10 out of 10 all round. Greta Thunberg has been all over the news saying that she doesn't regard Scotland as a world climate leader. I think that's a bit harsh, don't you, Robert? Richard, sorry?
Well, I think there's always, however well you're doing, you can always do better. And I think that while Scotland has done pretty well with setting ambitious targets, not to show the example of our power, but as others have said, to show the power of our example. Sometimes having somebody like Greta Thunberg giving you a kick in the shins and telling you can still do better is exactly what you need to hear. So, yeah, I would maybe file that under harsh but fair, but that shouldn't detract from the efforts that have been taken so far and the ambitious targets that we have in Scotland. But there's much to do, particularly in the northeast of Scotland, where we want to lead the way in the energy transition and industrialising the green revolution that we know needs to come. So I would take that in good part what has been said both by both climate change experts that you quoted there.
To be fair, Thunberg doesn't think anybody's doing a particularly good job. There's not anyone that she's latched onto and said, well done. She's been a bit Spartan with her praise. She's not saying whether she's definitely going to come to COP26. And when asked particularly about her views on the fact that there was now the SNP Green Deal, she seemed to think, I think she actually said, well, some politicians are slightly less worth than others, which I think is a bit of an insult to the Green movement, actually. I don't know what we'd need to do to get Greta on side. But as you say, let's not get ahead of ourselves. Let's not get too big for our boots. But I do think it's the case that Scotland is absolutely showing the way on this. And in terms of your part of the country in particular, Richard, particularly with the appointment of Lorna Slater's appointment, we should really begin to see some movement on the just transition agenda and better jobs, because I appreciate that that's absolutely terrifying for the oil and gas industry at the moment, and you must be hearing that from your constituents.
Well, yeah, I mean, we had Boris Johnson up visiting us, unfortunately, a couple of weeks back, and he went out to visit a wind farm development, offshore wind development in the Moray Firth, and tried to claim that Margaret Thatcher had been in some way leading the way in climate change by closing the coal industry, and that sent a shiver through a lot of people who work here. If that's anybody's idea of a just transition, is the way that towns and cities and communities right across the North and Midlands of England and central Scotland as well, much closer to home, they think that that's any idea of a just transition. The way that some of these communities were left to rot by Margaret Thatcher and her governments, it sends a shiver through them. It's just, that's the warning, and we need to make sure that we're going to need hydrocarbons for some time to come as both fuel and as feedstock. There's going to need to be further exploration. I would far rather that we were in charge of our emissions rather than subcontracting that to countries elsewhere who may not be as clean and as dutiful as we are in terms of trying to reduce emissions related to the industry. But the key point is that transition. It's not a binary switch from one to the other. We need that transition. And that's one of the things that I think is particularly good for the North East out of this deal. The Scottish Government had already put £62 million on the table for an energy transition fund. As a result of this governance deal with the Greens, there's now a £500 million pot to promote energy transition. And I think that's what's been missing. The UK government recently signed a sector deal with the oil and gas industry, which they're boasting away that it amounts to an £18 billion commitment. The thing is, it's about matched funding, and as the minister responsible at UK level said, it's not a fiscal deal, which is a polite way of saying there's no money up front. So already the Scottish Government, irrespective as to any other commitments it makes, has already put £562 million and signalled that that's available on the table to start driving forward the energy transition. Now, the Scottish Government doesn't have any regulatory responsibility for the North Sea for oil and gas. I wish it did. But in an area where it doesn't have that explicit policy responsibility, it's recognised its economic responsibility, its social responsibility, and the imperative to try and get Scotland ahead of the curve on this. In the North East, we have an awful lot of offshore wind. We've had a lot of onshore wind for a while. We've got the potential to develop transitional solutions like carbon capture and undersea storage. We could potentially be ahead of the curve in terms of how we develop blue hydrogen and green hydrogen. But the important thing is to start getting that transition going instead of just talking about it. And there are, going back to the first item, some very, very good things in the SNP Green Deal that we can hopefully use to start that ball rolling in the north of Scotland as we need it to, and elsewhere as we need it to be moving.
Well, not for the first time. I think the North East will again be a major battleground when it comes to the next referendum and even the next election. It's just interesting talking about Boris Johnson's comments about a green agenda at last year's Conservative Party conference when he unveiled that apparently the Conservatives were a Green Party. Who knew? He said it was time to denounce the MP who once famously said that green energy and wind power was a joke. It wouldn't even blow the skin off a rice pudding. He refused or declined at that point to say which MP had said that. Well, you'd be not surprised to learn, Richard, that in fact it was Boris Johnson himself. Sticking with the Prime Minister for now, he's returned to the West Country on Sunday to spend several days with his family, but Downing Street has said it's not a holiday and that he is continuing to work. In a briefing to journalists, the Prime Minister's official spokesman said Johnson had travelled to the west of England on Sunday and would be returning to Number 10 on Thursday. Asked repeatedly if the short break from Downing Street was a holiday, the spokesman said it was not. He's away from the office, but he's still working, he insisted. The Prime Minister had previously been criticised for deciding to head off on holiday in Somerset on the 14th of August, despite the perilous situation in Afghanistan with the Taliban advancing rapidly. Johnson was forced to cut short that break just a day later, being pictured at Taunton Station with aides on the 15th of August before chairing a meeting of the Cobra Emergency Committee back in Downing Street later that day. The Foreign Secretary Dominic Raab also came under attack for choosing to go ahead with a holiday in Crete before returning to tackle the crisis. Pressed on whether Johnson had felt free to leave his desk once the last UK personnel had been evacuated from Kabul on Sunday, his spokesman said, "I won't get into what dictates the Prime Minister's diary." So, Richard, when is a holiday not a holiday?
I don't know. I honestly don't know the answer to that one, but I think actually a little bit of honesty wouldn't go amiss. I mean, we can. I don't think anyone would begrudge anyone a break, no matter what job they do. But increasingly if we're not tethered to our desks, we have our little electronic tyrants and mobile phones that we carry around with us. Nobody, it seems, is ever completely isolated from from what they need to be connected to. And I'm sure the Prime Minister is no different. So, I think Dominic Raab, if his judgment was not for the first time, was completely absent in the fact that he tried to continue his holiday. But, with that said, I wouldn't begrudge anyone in government a holiday. But, we all know that their phones are on, they're easily contactable. My criticisms of Boris Johnson are many and varied, and they relate to his competence and capacity to be Prime Minister. But, even within that, I would not begrudge him a break away from his desk at Downing Street, because his effectiveness or otherwise, and as Prime Minister, and I tend very much towards the view of the otherwise rather than being effective, it's not going to be impacted one way or the other by the fact that he's decided to go down to Somerset for a few days.
I think there was a problem last year with his holiday. He was up in Scotland, wasn't he, near Applecross, and was he camping or not camping? It looked like he'd been kicked out of the house that they'd rented and was put in a tent, and that didn't last very long. I don't think I'm quite as I don't think I'd be quite as generous as you, Richard. I think, given what's happening on the world stage and given the UK's role in that, actually, Boris Johnson should just have stayed put and let his family get away, and he'd probably enjoy
That
some
might have
time
been
away from
that
it.
might have been politically wise, but he's not politically wise. But
No,
let's just a little bit of honesty. If he's on a break for a few days, that's what he's doing. Don't try and kid us that he's permanently connected. If anything's important, I'm sure they can get in touch with him. But yeah, his holiday last year just looked like a disaster. There was a tent pitched. Looked quite complicated. I suspect he didn't pitch it, given that he struggles to put up an umbrella. But it looked like his tent had an argument with a Highland cow at some point, and his tent had come off worst. So I'm sure it wasn't long before he was back indoors trying to warm up.
well, turning to a leader who's got a little bit more credibility, Chancellor Angela Merkel said on Tuesday that migrants who settle in Germany are German, even if they've foreign sounding names, making a subtle dig at widespread habit among white Germans of asking Turks born on German soil where they come from. Integration cannot be a 7 generation endeavour that never ends just because one isn't called Klaus or Erika, Merkel said with a wry smile during a ceremony to mark 60 years since Germany signed a treaty with Turkey to bring in hundreds of thousands of Turkish men to fill labour shortages in the 1960s. The question is, how long does a person who doesn't have a clearly German name have to integrate themselves before they are integrated? I think everyone should have a chance, at the latest when they've taken up German citizenship, to be seen as part of this land, and the name must play no role, she added. Merkel, who has led Germany for 16 years, plans to step down after an election on September the 26th, at which her Conservative bloc risks losing power as they trail the centre-left Social Democrats in the polls. Her Christian Democrat Party and their sister party, the Bavarian Christian Social Union, have seen their popularity sag gradually since her decision in 2015 to welcome almost 1 million asylum seekers, mainly from Syria and Iraq. Merkel's decision won her plaudits internationally but drew criticism at home as the mainstream Conservatives slipped in the polls and the far right gained seats in the national parliament for the first time since the 1933 to 45 Nazi era. The chaotic pull-out of NATO troops from Afghanistan has thrust immigration to the top of the election agenda, as Germany welcomed thousands of Afghans fleeing the Taliban, raising fears of a repetition of 2015 Europe's migrant crisis. Germany's Federal Labour Agency estimate that Europe's largest economy would need to absorb around 400,000 migrants a year to address labour shortages and a fast shrinking workforce. Germany has invested billions of euros on language courses and training to help asylum seekers enter the labour market, learning from mistakes it made with Turkish workers who received no help to learn the language and upgrade their skills. Quite a number of issues about this story. This statement sounds very close to the sort of the Scottish concept of civic nationalism that we promote here, very different from the sort of nationalism we often associate with Germany. Is that a fair comment, do you think, Richard?
Yeah, I think the parallels are quite striking, Maggie, in terms of the language that Angela Merkel has chosen to use here, because for many years, I think politicians, particularly pro-independence politicians, have been very careful about the language that they've used and to make the language inclusive. That that it doesn't matter where you've come from; it's where you're going that counts, and that we don't take a view of nationality that is based on birth, but it's about anyone who wants to be a Scot effectively can be, and that it's down to it's about, yes, it can be about birth, it can be about lineage, but it's also about residence, and that fundamentally the people of Scotland are those who have chosen to make their lives here. So as I say, I find it's striking and pleasing actually that Angela Merkel has chosen to deliberately use language that is inclusive like that, because Germany faces many of the same problems, as you alluded to, as Scotland does, in terms of a population that is aging, a requirement for people to come here to settle and to work, and also I think it's implicit in what Angela Merkel is saying, that she's recognising the very, very positive contribution that immigrants have made to Germany, whether that's socially, economically, or culturally. And, the same is our story in Scotland, because historically, of course, Scotland's one of Scotland's biggest economic problems and social and cultural problems hasn't been people coming to Scotland choosing to make their lives, which has been a thoroughly enriching process. It's been the number of Scots who felt that they've had to leave in order to fulfil their ambitions elsewhere, or whether, going back far enough, they have found themselves effectively being forced off the land and forced elsewhere. So I find it very encouraging that Angela Merkel has been able to use language like that, and I hope that whether it's the German election is shaping up as quite an interesting contest, but I hope that leaders of other parties, whether that's Social Democrats, whether Christian Democrats, or whether it's the Greens or anybody else, can continue to speak openly and honestly and inclusively about the benefit that immigration and the necessity that there is around immigration, and helps to take people towards that more inclusive view, that it's about anyone who makes their lives there is in fact a citizen of that place, because I think it's far more important where we're all going than where necessarily we've all come from.
Yeah, and there may be people who think that the centre-left Social Democratic Party are more likely to take that positive view about immigration. But actually, we know that in the left in Britain, that's not always been the case. It was elements of the Labour Party, and in fact, some elements of the trade union movement, who a few years ago were spouting British jobs for British workers and were absolutely turning their back on immigration. I think the key thing is, if you're going to embrace immigration in the way that Germany has, that you have to put your money where your mouth is, and you have to do everything you can to help people integrate into the labour market in order to make a contribution. And if you do that, then I think immigration stops being an issue. If you get integration right, immigration stops being an issue. Now, we've got some good examples of that in Scotland. We've got a national strategy for refugees, which I know there's a manifesto commitment to extend that to migrants in Scotland. There's no details on yet how that will operate. There's a skills recognition project in Scotland being developed, which will be rolled out nationally. And so it would hope, obviously Scotland doesn't have control of our own borders yet, but I think there's good evidence in Scotland that if you put money into integration, then immigration stops being the issue that it was. Anyway, we'll watch and no doubt report widely on what's happening as we get nearer September the 26th for the German election, because it will have a major effect on Europe, undoubtedly. More than 108,000 children have benefited from the Scottish Government's new Scottish Child Payment, according to the latest official statistics. The figures highlight how many families and children received the payment from introduction in February to 30th of June 2021. The £10 per week benefit, unique to Scotland, has the potential to help around 133,000 children, according to Scottish Fiscal Commission forecasts published last week. The Scottish Child Payment supports low-income families with children aged under 6. It provides regular additional financial support for families in receipt of qualifying benefits to assist with the costs of caring for a child. The payment will be made available to children aged 6 to 15 by the end of 2022. Parents and carers are able to apply for all eligible children in their household in a single application, and can also apply for other benefits for children under 6. Best Start Grant and Best Start Foods at the same time. Cabinet Secretary for Social Justice, Housing and Local Government, Shona Robson, said, "Tackling child poverty is a national mission for this government, and I'm proud that we are already supporting over 100,000 children through this brand new benefit. The Scottish Child Payment is unparalleled across the UK and unique in being a benefit to tackle child poverty head on." I believe that the extra cost for the 6 to 15-year-olds is going to be paid, I think, in a lump sum of £520. And it's been calculated that from birth to the age 6, with the three payments I've just discussed, a family could have up to £5,200 £20 by the time a child age 6. That's quite a healthy contribution to the family pot, yes?
Well, absolutely. And I think that we're talking about individually quite small sums. I think in terms of the overall pay, the amount that is paid out in the grand scheme of things, it's also quite small. But it has a bit like the uplift to universal credit of £20 that we've seen through the pandemic. That unfortunately the UK government seems determined to snatch away in a few weeks. It's something which is having an impact well beyond the actual scale of the financial commitment, because that extra £10, that extra £20, it's been the difference for families between sometimes putting food on the table or not, or paying a bill or not. So that additional support, modest as it can be, depending how you view it, I think across the lifetime of a child, it makes so many differences in so many imperceptible ways, and helps to maintain the not just the material well-being of families, but also the dignity of families. It helps because it's often said it's very expensive being poor, because you don't get the options to you end up deferring payments and paying interest rates. You end up on the most expensive energy tariffs. So it's a very expensive. You end up sometimes having to buy what you can afford, which may not end up being the best value. So it's a very expensive business, be it living in poverty. And if these benefits, particularly the Scottish Child Payment, can help to lift families, and particularly families with children, out of that poverty, they're absolutely worth every penny, because, as I say, there's already evidence that it's made the difference for a lot of families between sometimes putting food on the table and making sure bills are paid or not. And if it's helping to keep children in essentials, and helping to keep families helping to keep families in the standard that they need to be kept in, with the living standards that they're entitled to expect, making that contribution towards that, I think it's something that is incredibly positive, and you can only say positive things about it.
Well, as you say, the impact of it will be very badly affected if and when the £20 uplift to universal credit ends, as it undoubtedly will do. The Scottish Government have also pledged to double the amount to £20 a week for each child by the end of this parliamentary term, or by the next election rather. But there are a number of poverty campaigners saying that needs to happen quicker than that. Now, given all the demands on Scotland's budget as we recover from COVID, is it likely that they're going to be able to afford to double it in, the next 12 months, which is what people are calling for?
I think if it was possible to double it in the next 12 months, the government would have said that was exactly what they intended to do. Look, I'm pleased that the payment is in place. The timeline of doubling by the end of this Parliament, I understand the reasons for that. If it's possible to do it more quickly than that, then absolutely it should be done, in my view. But there's no point and it would be cruel to make promises that can't be kept for whatever reason. So, I trust the Scottish Government, having made the commitment, to stand by that commitment. And I am sure that if it is possible in terms of the financial position of the Scottish Government going forward, to bring that date forward where the payment doubles, then I would very much hope that is one of the things that they look at doing.
I mean, we've talked a lot on this programme recently in the last few weeks, when we've been looking at drug deaths and deaths from alcohol, that actually poverty is at the root of it. And unless we get the massive discrepancies in Scotland between people who have and people who have not, we're going to be fighting those sort of rear-end battles all the time. So, it's one of these things, if you invest now, does it actually save you money down the line in terms of health? But presumably there's somebody doing the number crunching somewhere, and we'll look to see if that increase can happen sooner. Options for Scotland's future approach to assessment and qualifications have been published. Renowned Professor Gordon Stobart, who was appointed by the Organisation for Economic Cooperation and Development, considered approaches taken around the world as part of his work. Possible options include the development of a senior phase qualification system based on a combination of teacher assessment and exams, The simplification of the S4 to 5 assessment by decluttering the historical diet of exams, the increased use of online exam resources and oral presentations as an assessment format, the inclusion of pupils' views in decisions around assessment, and enhancing the role of vocational qualifications. These suggestions will be considered as part of a wider conversation with learners, teachers, parents, and others on how Scotland's qualifications and assessment system can best evolve in line with the curriculum and society of today. Stobart has praised in his report Curriculum for Excellence, says it's the right way to go. Obviously, this is coming about because of COVID, because for the last 2 years, exams have had to be scrapped, and also because of the shake-up at the Scottish Qualification Authority. One of the things in that list strikes me, Richard, there's lots of chat at the moment, especially in the third sector of service provision, of co-production, the idea that you develop services with the input of service users. It's a modern version of the nothing about us without us. But I do smile quite wryly at the thought that the inclusion of pupils' views and decisions around assessment, I think we can guess what that might be.
Well, maybe.
What do you think what will that add to the debate, do you think?
Well, hopefully something constructive. I mean, I think it's reasonable to have an understanding of how candidates for exams, and assessment experience that assessment, and to take on board what you can from that. I mean, it's not that anyone's getting any input into what their grade is beyond what their own efforts would entitle them to. So, we're not getting to mark their own papers just yet, or their own assessments just yet. And but in terms of taking on the views, I think that's positive and overdue, to be frank. I mean, there's always a tendency for folk to look at the education system through the prism of what it was like in their day. And I always vowed I would never do that, but I'm afraid I'm going to have to, in order to answer this bit, that, when I was doing the revised hires back in the day, sort of around about 1993, 1994, when I was at school. And there was that dash, that unseemly leap that there was between, doing your standard grades as they were by that time to your hires, just the difference in what was expected of you and how much you had to cram into those short terms, and then the sort of mad dash for 5 hires if you were hoping to go to university, and then kind of what do you do in 6 year? Well, even more hires to no purpose in a lot of cases. So continual assessment was something I didn't really encounter until I got off to university, and I found that a much more congenial environment and realistic environment, because exams are a totally artificial, particularly now, a totally artificial setting in which to demonstrate your knowledge of something. There is no situation where you're in life where you're ever going to be suddenly put on the spot like that, where you don't have recourse to external resources. And the other thing that, finally put the tin lid on much of the exams as a means of assessment for me was precisely in the pandemic, where there was such a gulf initially before teacher assessments were accepted as they were. There was such a gulf between what had been projected for candidates and then what actually came out the other end. And it just makes me wonder that why when it seemed to be the candidates from lower social economic backgrounds, or poorer social economic backgrounds rather, that seemed to be getting their grades managed down far more than candidates that were coming from more prosperous backgrounds. Obviously, we're generalising there. So you just wonder how long that has been going on for. So for me, I'm no fan of exams at all. For me, it's a realistic, I wouldn't want to rely entirely on teacher grading and opinion, although that's clearly important, or assessment, but giving people the chance to succeed in realistic environments, which gives them the chance to learn at a continuous rate, to demonstrate their knowledge in a way that is relevant to the life that they're about to go on into, and which doesn't reward those who have crammed and who have taken great skill, or their parents have paid for them to get tuition, where they get to understand the way that the papers are asked, what the papers are the questions in the exam papers are really asking. Let's try and find a way of assessing our young people, which actually comes away with a realistic judgment of what it is they've learned and how much they've grown and they've developed, and which opens the doors for them that they need to have opened in the next stages of their life or their further education. Because for me, for an awful lot of years, the examination system has not been cutting it in that regard at all.
No, I would agree with that. I have slight concerns around too much emphasis on continuous assessment, because there's lots of evidence to prove that that helps children from more middle class backgrounds whose parents are more willing or able to encourage them to do their homework, perhaps even help with their homework if they're submitting assignments that then get assessed. I think the most exciting thing in that list, and the thing I would love to see more development on, is the increase in vocational qualifications. I think that's the way forward. And in that would bring us much more closely in line with our European neighbours. Further funding has been announced to provide short-term care for acutely unwell patients in their own homes. An additional 2.6 million has been shared between 10 health boards so they can continue to develop hospital-at-home services to avoid admissions to hospital. Evidence shows this particularly benefits frail and elderly patients, since hospital admissions are associated with higher rates of delirium and increased chances of admission directly to care homes. A patient's ability to function can also deteriorate while they're in hospital, meaning they have higher needs for community care when they're discharged. And they're also more likely to experience a delay in their discharge from hospital. Being cared for by hospital at home increases the likelihood a patient can continue living at home 6 months after a period of acute illness without being admitted to a care home. Well, Richard, obviously admitting people to care homes straight from hospital was one of the things in the early days of COVID which caused such decimation of elderly people being affected by COVID and dying. So that has to be welcome if that doesn't happen. Bed blocking is another issue when elderly people are admitted to hospital. So I think everyone agrees that in theory this is the right approach. I'm just wondering who's going to carry out that care hospital at home when we know that the NHS is under such massive pressure for staff at the moment.
Well, the NHS is under pressure for many reasons, and we're aware of the problems that have been for roundabout bed blocking, whereby patients who are ready to be discharged, particularly elderly patients who are ready to discharge, haven't been able to because there's not a suitable care package in place. And I know that the integration of health and social care in many parts of the country has helped to improve that situation and help to get improved care paths and therefore better outcomes for patients. I know that the enablement programs that many of the integrated joint boards have to help restore function to people so that they're not so that they're able to get back to a level of function that enables them to live as independently as possible after a period in hospital, again has tremendously positive outcomes and has done for some time now. But I think sometimes it is important to take that step back. Sometimes receiving acute care in a hospital setting will be the only appropriate outcome. But where there is the ability to plan, where we're not making an emergency admission, where there's the ability to plan somebody's care, where that care can be delivered at home, I think we should be looking to do that, because there can be many unintended consequences from hospital admissions. It can be incredibly disorientating, and it can reduce the chances of the chances of making as full a recovery as possible are quite possibly better when the treatment that takes place at home is happening in familiar surroundings, with friends and family being able to get access there. So I think this is something that's clearly had some early successes, and this additional funding is something that not only leads to better outcomes. I think that those better outcomes could end up taking additional pressures on staff and time and resource out of other parts of the system. Again, it's almost part of that preventative spend that we were talking about earlier, that a medical intervention is necessary, but if it's possible to do it in this way, we then get a range of better positive outcomes, not least for the patient themselves. And I think it's tremendously encouraging that the Scottish Government is continuing to invest in this.
It's not clear why the specific health boards have been chosen, whether these are health boards that feel they have got additional capacity or whatever. And I guess it'll be some time till we kind of see the results of that. Although, yes, I agree, being cared for at home, if at all possible, is clearly, we know, is better for you and makes your recovery quicker. As someone who was in hospital last year for a fairly major surgery, I was kind of surprised, but also delighted just how quickly they were prepared to bundle me out of the door to get back home. And although I was slightly alarmed, because I clearly was not in a very good state, it is clear that I did make much quicker progress being looked after at home, even though that was really just with family. Linked to that story is a new report that Scotland's social work, social care and early years workforce is surprisingly perhaps bigger than ever, employing some 209,690 people, which is a rise of 1.6% since 2019. The report published by the Scottish Social Services Council shows the sector makes up approximately 8% of all Scottish employment, or 1 in 13 jobs. The Scottish Social Services Sector report on 2020 workforce data highlights the size and importance of the social work, social care and early years workforce, which has played such a vital role during the COVID-19 pandemic. Now, when I saw this report, Richard, I was really amazed because I was in a meeting just today where people from Care Scotland were talking about the massive shortages that they're suffering that were bad before the pandemic, are even worse, combination of people leaving the service because of the stress they've been under and Brexit. The 1.6% increase isn't on the surface all that it might be, because when you dig deeper into it, it's actually mostly in either the care at home subsector that we've been talking about or through daycare of children. It's not really having an impact, for example, on care homes. So I'm not sure we should be celebrating these figures quite as much as the report suggests.
Well, I think one of the things that we hopefully can celebrate is, I think there's certainly since the pandemic bit, there has been I would hope, a renewed appreciation for the work that those in the caring sector do, whether that is through the expansion in early years childcare, or whether it's those who have worked in care homes throughout, or everybody who is engaged in a caring profession, helping people to live the best lives that they possibly can. Because, let's be blunt about this, the people who got us through the pandemic weren't the bankers or the stockbrokers or even the politicians, dare I say it. It was the folk who were rolling their sleeves up and looking after those who were in need of that care. So I would hope there's a renewed appreciation around that for what folk in the caring sector do. It's a section of work where I don't think it's been adequately rewarded in the past, and I think that we appreciate people hopefully have that greater appreciation of the value that the caring sector adds.
Well,
Because a country doesn't just need a country doesn't just need its physical infrastructure; it needs its caring human infrastructure as well. I think I can tell you're about to tell me that people don't get paid enough in this sector.
Well,
I would agree with you.
not
That's
just
what
that
you're
people
about to say.
don't just get paid enough. I mean, one of the quite surprising things is 1 in 10 people who work in the care sector are on 0 hours contracts. Now, this is in complete contrast to what the Scottish Government is trying to do with their Fair Work agenda. And 20% are on non-permanent contracts. There's not enough men work in the care sector. The median wage is £10.50. And the problem is that so much of the care sector is run for profit. Now, we're just about to go into a consultation on the National Care Service, so if people really do care about the care sector, now is their chance to speak about it. One of the things that a lot of people are hoping for is that it is no longer a privatised sector, or privatisation is halted, and that it's brought back into the public sector. And Scottish Care, who I was talking about later, have been writing to the Home Secretary, good luck with that, to say that Scotland's care service should be added to Scotland's shortage occupation list, which would allow them to bring in people from overseas to work in it. The problem being, of course, that people probably wouldn't be earning enough money to meet the salary levels that they need to in order to be able to work. So I think you're right. I think it has absolutely shown up the need for the care sector to be regarded as hugely important. I'm just not convinced that it's going to be as simple as that. There's a lot to do. But if you are working in the care sector, you have family in the care sector, and you're concerned, then do get on to the Scottish Government website and have a look at the consultation and have your say. It runs for about, I think, another 10 or 12 weeks. Sadly, that's all we've got time for this evening. We've covered a lot. Thank you, Richard, for your input as ever. Informed, we didn't fall out too much there at the last story. Thank you for watching. Remember, as we say at the end of all of these programmes, it takes money to keep these programmes running. We are out 5 nights a week and on a Sunday. We've got a fantastic outside broadcasting unit that we're just eager to get out on the road. We've a lot to cover in the coming months and years with constitutional change and elections. If you've enjoyed the programme, please go on to the website www.broadcastingscotland.com /broadcast Scot and make a contribution to help keep us. We've a tremendously professional setup here, and we do need your support to keep going. I hope you've enjoyed the programme. Have a pleasant evening, and I'll be back on Thursday. Good evening.